Showtime.
So that you guys, so good afternoon and welcome to voting list number 19. It is Saturday, April 16. This is the Health and Government Operations Committee. I'm your chair, Jocelyn Peña-Melnick. To my left is the vice chair, Delegate Bonnie Collison. We're going to have one bill, and I thank the committee for being flexible because I know we have had a long day. It is Senate Bill 1006. And this is the bill, just as a refresher before Aaron presented, that would allow, and it's going to be the way it's presented now is limited, a local bill, and the Baltimore City delegation gave us a letter that they would like to use the funds to pay for medical bills that are outstanding for the citizens in Baltimore City. It is limited in scope. Erin?
There's a reprint of Senate Bill 1006 in front of you. This bill passed the Senate unanimously and has been amended, as the chair said, to make it a Baltimore City, to only apply to Baltimore City hospitals and residents of Baltimore City. The bill authorizes the hospital located in Baltimore City to sell debt owed by a patient that is a resident of Baltimore City for hospital services to Baltimore City or an entity that is under contract with Baltimore City for the sole purpose of canceling the debt. The contract between the hospital and Baltimore City must state that the sole purpose of the sale of the debt is to cancel the debt. The patient is not responsible to the hospital, Baltimore City, or the contractor for any amount of the debt that is sold or any interest, fees, or costs associated with the debt or the sale. The debt sold must be for hospital services provided at least 2 years before the date of sale, may not be expected to yield additional reimbursements from a third-party payer, may not be subject to an open appeal with an insurance company, and must be for an individual whose family income is at or below 500% of the federal poverty level, or who has medical debt exceeding 5% of the individual's family income. HSCRC must treat the amount of payments to hospitals for debt as an offset to uncompensated care amounts reported by hospitals. The purchaser of debt must notify the patient that the debt has been canceled, and if the hospital obtained a judgment against the patient or reported adverse information to a consumer reporting agency about the patient, seek to vacate the judgment or strike the adverse information. For hospitals located in Baltimore City, their annual report to HSCRC must include the debts owed by patients of the hospital that the hospital sold to Baltimore City or a contractor, the total dollar amount of the debt sold by the hospital for the reporting year, the total dollar amount paid to the hospital by the unit or contractor who purchased the debt, and the total number of patients whose debt was sold in full or in part to Baltimore City or the contractor who purchased the debt. The bill terminates December 31st, 2026, and this aligns with when the ARPA funds that have already been allocated must be spent.
And just before I go to questions, this is an opt-in program. The local governments and hospital could choose to participate or not participate. It is not a mandate. It is up to the hospitals if they want to do that. The advocates work closely with the HSCRC to make sure that they're okay with it. Baltimore City will use American Rescue Plan Act, ARPA funds, to purchase the medical debt. The bill is time sensitive because ARPA funds must be obligated by December 31st, 2024 and spent by December 31st, 2026. And ARPA funds have already been allocated to Maryland jurisdictions, and the bill has a sunset of December 31st, 2026. This has been done in several states and cities. They use ARPA fund. Some of those include New Jersey, Connecticut, Cook County, Illinois, Akron, Ohio, Cleveland, Ohio, Toledo, New Orleans, Washington, D.C., New York City, New York, St. Paul, and Minnesota. In New Jersey, $10 million was proposed by the governor and is being used to fund their pilot program to cancel an estimated $1 billion worth of medical debt. Connecticut is using $6.5 million to purchase $650 million in medical debt. This is just for Baltimore City hospitals and funds that have been allocated to them already. And I'm going to go to questions now. I saw in the order that I saw it, it was Kaiser, then Taveras and Bagno, and Morgan and Shalega, okay?
Thank you, Madam Chair. I was very happy to hear and see that this sunsets at the end of 26. I think that dealt with some concerns that were brought up about the ARPA funds and whose funds were they and so forth. So I appreciated seeing that. My question, and I just want to confirm what I think I heard, is this essentially just an accounting trick to get rid of people's medical debt? Because if it's anything more than that, I'm worried about creating some third-party process that could grow into something worse over the years. So is it essentially just a selling of the debt for the purposes of erasing the debt? Is that,
That's
and that's the
correct.
only use it could be?
Yes,
Okay, thank
very
you.
limited.
Okay, thank you so much.
You're welcome. Taveras.
Yes, there had been an individual that came before us. I guess he was a buyer of that, I'm sure. This was,
But that is different. That is an amendment that they wanted to allow a private party. This is not, this is Baltimore City, an entity.
So
This is very limited.
okay, so that, I'm just making
It's not
clear that
included.
this didn't make, I'm not seeing it in, so it didn't
is
make
not.
it in. And so they're limiting it to just the city. And the difference between that one and this one is just that was a statewide bill and this one is not.
That's correct.
Got it.
Yeah, and it has a sunset. Delegate Bagnall, then Morgan, then Shalega, then Hutchinson.
Thank you, Madam Chair. And I just wanted to clarify that I'm understanding this correctly. So it is limited to Baltimore City, but the overall impact, because it's working with the HSCRC to clear that debt, is it would still positively impact our global budget and our waiver for charity care. So that would be the impact
That's
on the
correct.
state. Is that correct?
That's
Thank you.
correct. We have Morgan and then Chisholm.
Thank you, Madam Chair.
You're welcome. Thank you.
So I appreciate the committee making this a local bill. It made it much better and more attainable, but it's really not, it doesn't fall under local courtesy in my view at all. From a small county, we're told every time that if we submit a bill and it's local and it sets a new precedence for the state, then it doesn't receive local courtesy. And I have concerns because the ARPA funds were originally designed to pay workers investments in sewer and water and broadband for people to get through the COVID challenge, through the pandemic. And the pandemic has been over with for quite some time. It was never set up to pay for medical bills. And to that point, as far as paying debt, it went so far as the legislation went out of the feds even put limitations on transferring it to pension funds because they wanted the money to be spent and used as an economic driver in the economy. I don't think paying off debt when we already have an unconfiscated care fund set up, meets that goal. So I'll be voting no.
So I would say that disrespectfully to you that to the contrary, the federal goals of ARPA funds are to provide fast and direct economic assistance for American workers, families, small businesses, industries, and to address issues related to the continuation of COVID-19 pandemic, right? So COVID it exacerbated many social factors that affect health. Also known as the social determinants of health that we address in this committee, and medical debt is one of them. And the bill will help, particularly those living that are very low income. They have this debt and they cannot pay it, which is why it's being allowed in other cities and states have been able to use it. But thank you, I appreciate you. Delegate Shalega.
Thank you. So it limits Baltimore City hospitals and Baltimore City patients, is that right?
Yes.
So what if a Baltimore City patient went to St. Joe's?
It cannot be used because the bill specifically says it has to be a Baltimore City hospital and, right, a Baltimore City resident.
What if it was a Baltimore County resident that went to Union Memorial?
It cannot be used. It has to be, again, a Baltimore City resident because our Baltimore City funds that were given to Baltimore City for the Baltimore City residents, and it will be used for Baltimore City residents where the money, the ARPA funds were intended for that local jurisdiction, and it will be for a Baltimore City hospital, but it is not or, it is an and. It has to be both in order to meet the criteria under the bill.
And you might recall, I asked whether ARPA funds could be used. I would like to use my one hold on this bill while I get an AG's opinion. I mean, we each get
It
one
is.
hold. I haven't used mine yet.
Yeah, it is. The only thing with that is that Monday we adjourn, right? And these funds expire, right? On Monday, they expire. So this is what I will propose, given the time limit, that we take a vote, we hold it for you for that opinion. But, you know, it is, we have to move the bill because the funds will expire. Okay? And then, and can we make the request, can you, do you want us to make the request for you for the AG, or will you do
Sure.
it today?
Yeah, that'd be great.
What would you like that opinion to say?
To ask if it is legal to use ARPA funds for this purpose and the legality of not giving relief for Baltimore City residents who use a different healthcare. So like I said, if you live in the city and you go to St. Joe's, if it's for city residents, it's for city residents.
Yeah.
That doesn't seem equitable that you wouldn't then relieve their debt just because they happen to go, 1 mile across the county line to get their health care.
And thank you for being flexible, for allowing for the compromise, is that we will seek that opinion today. Erin is gonna send it while we're here sitting. And we'll take the vote and we'll see for that answer to, when it comes, okay?
Okay.
Thank you. Delegate Hutchinson.
Thank you, Madam Chair. Do we know how much money is available for this and how much debt exists?
We do, may I?
Okay.
Will you please come up, introduce yourself, identify yourself, and please answer the question? Thank you.
Nina Themelis, Director of Government Relations for Baltimore City. So we right now are setting aside about $1 million or possibly less, which out of the $641 million that the city received is a very small portion. Our estimate is the total debt that exists for Baltimore City residents is around 36 million. The eligibility criteria would further lower the eligible amounts that we would be able to cover. And then additionally, depending upon the reduction in rate that we would receive, if we receive $1 purchasing $100 of debt, if that number, even if we were able to cover 35 million, it would cost us approximately $350,000. So it's a very, very small amount of money that will have a very big return on impact for our residents.
And may I ask you a question? Did the other jurisdictions use ARPA funds?
Yes, multiple cities across the country have utilized ARPA funding for this express purpose.
Okay, and do you know the answer to Delegate Shalega's question?
We did not receive an AG opinion, but this has been validated by our Mayor's Office of Recovery Programs as an eligible use using the final rule from the U.S. Department of Treasury for ARPA.
The U.S. Department of Treasury.
Yes.
Okay.
For Baltimore City people, then it should be for, if you're going to limit it to that.
Okay. All right. So we'll ask that part of the question. And the other one. Delegate Hill, Delegate Hill, then Lewis.
Thank you. I'd like to follow up on that. As I recall, the ARPA funds, there are some specifics about the use, but there's nothing that says it has to be equitable across. So for instance, as far as Baltimore City could say, we'll cover Baltimore City and Baltimore City residents and hospitals here. They could say, as Delegate Shalega suggests, or any hospital debt that they incur anywhere in the state. They could say any hospital debt that they incur anywhere in the nation, so there was nothing about the ARPA funds, as you understand it, that requires that it be broadly equitable in that sense. It just has to be specified what the use is. Would that be?
That is correct. We've stood up a number of programs and forms of payment for small businesses, residents in various formats. And we'd like to help everyone, but that's just not the reality of the situation for the amount of money that we've received. So we apply the criteria equitably, but we can't cover everyone, but yes.
Okay, Delegate Lewis, followed by Morgan.
Thank you, Madam Chair. A A couple of thoughts come to mind. First, I guess for Ms. Demolis, are you aware of the impact of medical debt on health outcomes for individuals?
I
If you're
know-
not, it's fine.
Yeah, I know a little bit about it. I think that anyone who incurs medical debt is much less likely to go for routine services because they don't want to add on to the debt that they already have accrued. They also are less likely to go not only for routine care, but serious, more serious medical issues because of that fear of incurring more medical debt. And then just additionally, the stress multiplier of knowing that you have a significant amount of money that you owe has negative health outcomes as well.
Worthy response. So thank you for clarifying that. So by lifting the burden of medical debt, we actually can have an income on health outcomes for individuals who are carrying the debt. And the other thing I want to make sure I understand, jurisdictions all over the country received ARPA funds. Is that so?
Yes.
So jurisdictions such as Garrett County, Dorchester County, the city of wherever in whatever county in Maryland, they were eligible for and may have indeed applied and received ARPA funds specifically for their jurisdictions. Is that so?
Yes.
So if those jurisdictions choose to follow a model like is being proposed for Baltimore City, those jurisdictions can apply their own ARPA funds as they may be allowed to do. So if other jurisdiction wanted to relieve medical debt of their residents who's getting care in their hospitals, those jurisdictions could possibly do so. Is that right?
Yes.
Thank you. Thank you, Madam Chair.
Delegate Morgan, followed by Alston, followed by Chisholm, followed by Rosenberg.
Thank you, Madam Chair. So
I'm
I just
trying
want-
to be balanced.
Yeah,
Okay.
thank you. No, very good.
Okay.
So make sure I understand this. So a resident of Baltimore City that has medical debt, these funds would be allowed to pay for their medical debt, correct?
Yes.
Now, under the pandemic, if you're a resident of the list, my colleague just read off, Dorchester, Wacomico, St. Mary's or something, and you had medical debt, well, these funds wouldn't be used to pay off those medical debts, correct? Because they were not residents, right?
So the purpose of this bill.
That's correct, right?
No one up until now.
Because they're not a
currently.
Baltimore City resident. They wouldn't be getting their debt paid off, correct?
In the state of Maryland, no hospital is able to sell medical debt, period, if it's for the purpose of cancellation or if it's for the purpose of selling.
That's not
to
my
third-party
question. The
collectors.
question is, if they're residents of those counties, their debt wouldn't be getting paid off, correct?
They could be seeking the same benefit from the state of this change in state law that
How
we
would they
are.
benefit from the state?
It was initially a statewide bill.
The bill that we're talking about now
Yes.
deals with Baltimore as amended, deals with Baltimore.
It's limited.
City.
It only applies to Baltimore City.
Understood.
Yes.
Yes,
It only
that's
applies
the
to Baltimore
answer.
City. So if you're in any one of the other counties in Maryland and you obtain medical debt due to COVID, this bill does not apply for you. Isn't that so?
That is correct.
Okay. Now, in my county, we don't have leftover ARPA funds because we use that money and I think they bought thousands of laptops for the residents because that's what the goal was, to get people online. It was under broadband and they handed it all out. Now, I think it's hypocritical that literally after 2 hours after we're on the floor debating a joint resolution about equality, we're going to pay for some people's medical debts in the state and not others, because those other counties choose to use the money for the intended purpose. That's it. Thank you.
So I would say, Delegate Morgan, and you know I love you, that your county chose to use the money to buy laptops. Baltimore City is choosing it to pay for the debt. So it depends on what the needs of those particular jurisdictions are and how they want to spend the money. So it's the bill came in, it was broadly, but we could read the room. And Baltimore City has the money. So this is trying to find a compromise so that the money that expire in December could be used for some benefits. But I understand, what was it that delegate philosophical difference? What was it? Sue Krebs, Sue, how are you? I hope you're well. Delegate Krebs, a difference here we have. But thank you, Delegate Morgan. And thank you for being patient. I know you didn't know we were gonna call you, but I want to thank you on behalf of the committee for being patient and being flexible, okay? So Delegate Olston.
Okay, so I think part of my question might be a piggyback on Shalega's, which was if the person lives outside of Baltimore City but incurs the debt in Baltimore City, will that be covered?
It is not, because Delegate Olston, the bill is drafted where it says it has two things have to happen.
Mhm.
It has to be a resident of Baltimore City.
Okay,
It has to be a hospital in Baltimore City. And it has to be an A&D, both, because the money were given for Baltimore City residents.
okay.
And the money, because it was given for Baltimore City residents for each jurisdiction, they wanted to come back to Baltimore City residents.
Got it. And then the second question I have is there a way for us to put enabling legislation or enabling language in here for any other jurisdiction that may have leftover funds that chooses to use it in this way to do it? So like if Prince George's County had money and we wanted to be able to do this,
That would not, we cannot, because this, as it came, now we have it, the Baltimore City delegation voted, it's a Baltimore City delegation now. It came in originally that way for everyone, but we could read the room, right? Where there wasn't a lot of appetite for it. And then this money expires in December for this jurisdiction. They came forward to it and we adjourn on Monday and we want to help them to use that money.
I understand, and I would like our county to be able to take advantage of it as well to the extent as possible. I'm just hearing about this. I'm not
Yeah.
familiar with the program, but it
Right.
sounds like it could be a good idea if people have it instead of losing the money. And that's why I'm asking, can we
Right.
do something?
Not
where
on
other
this bill. Not on
There's
this
no
bill.
other vehicle.
Yeah, but we cannot on this bill. Okay. Delegate Chisholm, you're welcome.
So I know you went through some numbers, so I apologize if I ask you to repeat, but how much is available now in ARPA funds for Baltimore City?
Available or the total number we were allocated?
Total number
initially?
you're allocated,
I was about 641 million.
641 million. And do
Yes.
we know what the total number is that fits into this by category of resident of Baltimore City and Baltimore City Hospital, what that total number is as far as medical debt?
We currently have a rough estimate as far as the total amount of medical debt for Baltimore City residents, which is about 36 million. We are setting aside $1 million or less for the purpose of paying off medical debt if we're able to have this piece of legislation pass. We do not have the ability at this point in time, because we do not have access to the hospital records to know specifically what subset of that total of $36 million would fall into the category of being both a Baltimore City resident and having accrued debt with the Baltimore City Hospital.
But right now you're thinking about using $1 million worth of, is it
It will
correct?
likely be less than that, but yes, approximately.
And you would go to the hospitals and it's almost paying pennies on the dollar or 10 cents on the dollar, say, we'll buy all this debt. Is that correct? If I
The rate will
understand?
be negotiated between the hospital system and the city, yes.
So, which is why I ask, is I do wonder, how do they figure out, okay, who's debt? Because obviously it's a small percentage of the total debt. Who determines it? Because there's probably going to be a lot of people that fall into these two categories based on the number you just gave, because it's a huge number. Who then determines what debt is going to be purchased with ARPA funds and done away with?
So the city will be working with a third party that has done this in multiple jurisdictions throughout the country. They work with the hospital system to engage with them to ensure that they opt in to working with us. They will then use that data to analyze it to determine which potential records will be eligible. And then we'll work with the HSCRC to ensure that this program would work in complement with the existing medical debt program.
Because I'm curious if they would go for the greatest need or if they would go for the oldest debt, because obviously the older debt gets, the less likelihood it's going to be paid. But I also wonder, and it's Baltimore City, they can do what they want. But are we going to start to pick winners and losers because you're not going to be able to pay off all the debt?
Yeah, we're well aware of that. One of the criteria is that the debt has to be older than 2 years.
Okay.
So at that point, the hospital system has likely already written it off, which means that it would just be a net positive for them, as they've already accommodated for the loss of that debt. But it would obviously have a more significant impact on the patient themselves being able to have that off of their record.
Okay, thank you.
Thank you for your questions, Delegate Chisholm. What was it that I said? I think I said Rosenberg, right? Rosenberg.
Thank you.
Keep me honest, okay?
Thank you. So if I may, this is a program that other cities and states have used. This is a means by which they have expended their ARPA funds, correct?
Yes, in at least 17 states.
And you're also making sure that it's consistent with state law by working with a state agency, state commission.
Yes.
Thank you.
Okay, Delegate Shalega, followed by Lewis, followed by Collison, and then Hutchinson.
Thank you, Madam Chair.
You're
There are
welcome.
3 questions on the testimony from the Hospital Association. I'm wondering if they got answered, indicate how the list of patients whose debt is being purchased will be compiled. It's kind of what Delegate Chisholm was saying. Nor does it state that the contractor will be responsible for contacting those patients. There's another question, describe how either the hospital or contractor would know whether a particular patient's debt is subject to an open appeal with an insurance company.
You want to address that, please?
Sure. So we did work with the Hospital Association. They had no remaining issues. We met with them directly on several occasions. As far as the analysis of the data, we would be working with the hospitals to receive data, analyze it, ensure that all of the information was accurate and updated. And then as far as any existing claims, we would be working, I believe, through maybe the HSCRC, but I know that the Hospital Association, I asked them to come to you directly, but they did state that they had no issues with the legislation.
And then finally, was the amendment that was offered by debt collectors?
Yes, and I believe I spoke to it briefly in the previous hearing. At this point, I think that would open up the door for purchasing medical debt, regardless of whether there's a 0% interest rate. We don't have any interest in being in the field of debt collection. We are in the field of debt cancellation. If this honorable body will pass our bill. So we would urge to keep the bill as narrow as possible and not open the door for any third-party collectors.
I think that's what it says. Debt buyer agrees to not resell or otherwise transfer any patient debt. Is that in the bill? Because I think that's what this amendment is trying to do, is keep you out of the business of buying debt.
And I don't want to speak too much to the amendment. My understanding, based upon my conversation with one of their lobbyists, was that they are a third-party collector, since there is no ability to sell medical debt in the state. That they have no opportunity to do that here. They would not be canceling debt like we are. They would still be contacting the patients for continued collection. So I don't know what their rate might be or how they might operate, but it doesn't have the same purpose or goal of what we're trying to do.
Because that's a profit, for profit. Very different. Delegate Lewis, was that it? Yeah, Lewis. And then let me just be balanced. Let me do Lewis. Let me do Hutchinson. Let me come back to, you guys don't know this, but I try to have 2 different perspectives, right? Not pile up. So thank you for the flexibility. Let me go to Lewis.
Okay.
Thank you.
Thank you, Madam Chair. And I actually really appreciate the discussion and the thoughtfulness, because what the bill proposes to do is novel. It's new, it's innovative for the state of Maryland. We're behind, what did you say, 17 other states? So we're kind of coming up the middle of the pack, but it's new for us. So it's good to take the time. And I appreciate my colleagues staying late on the Saturday before Sine Die to help us get this get in the best shape we can. I just want to make sure that I understand that amendment that we're just discussing. The way I read it, and maybe you can help me understand this, Ms. Themelis, the way I read that proposed amendment is that in addition to the provisions we just spoke of, it also includes, as I understand it, an opening for hospitals to claw back debt that's been paid, that's already been paid. And I don't have the amendment in front of me, but either you, Ms. Themelis, or maybe council could demystify this a little bit. But there was language in that amendment to the effect that hospitals can be reimbursed using the ARPA funds that were used to cancel the debt. They have claim if the patient's debt has been canceled, the hospital wants that money. And I just want to make sure that I understood that, because if that is the case, if I'm understanding it, that would be a strong reason for me to reject that amendment. So can someone help me make sure that I understood that part?
Delegate Lewis, that amendment was an amendment to allow a third party to be able to buy the debt and then pursue it from the individual that owes the debt. They still owe the debt. It's not a cancellation like it is here to the very, very poor. And the amendment is not in front of us. Okay, thank you. May we, I want to be balanced. Delegate Hutchinson.
Thank you, Madam Chair. Who said that my perspective was going to be any different than Delegate Collison or Lewis as well? So you don't know. I'm tired, and so I need to.
I love it.
You said the city received $651 million in total ARPA funds. 641, and they've used that for a lot of other things.
Yes.
And how much is now left that will be going to this program?
We currently are setting aside up to $1 million.
So 1 million of 650, or I'm sorry, 640, what that you said. Let's just, I know you don't know the number, but you said 35 to $36 million in debt exists in all hospitals, all patients in Baltimore. Let's just say it's 50% would be eligible with the income level. So 17 to $18 million is out there. What can 1 million do to, like, how much can be eliminated with $1 million?
So that'll depend upon the reduction that the city would receive in purchasing this old debt from hospital systems throughout the country. We've seen rates as low as $1 being able to purchase $100 of medical debt. So the amount or the ability for the city to cover all eligible debt would be based upon the rate that we receive through negotiating with the hospital system.
And then you would have to figure out an equitable way that $1 million will be dispersed through all hospitals in
So
the city?
it's an opt-in program with the city, with the hospitals. So it would be, we would approach the hospital systems, determine whether or not they'd like to participate in this debt cancellation process. Rates would be negotiated directly with those hospital systems. And then we would analyze the data of those patients whose records we receive to then be able to cancel that debt.
Okay, and that $1 million goes to those hospitals that elect to opt in.
Correct.
Thank you. Thank you.
You proved me right. You proved me wrong. Go ahead. You proved me wrong, and I'm gonna take a risk. Delegate Riley.
Thank you, Madam Chair. So my question is, so there's a lot that this bill is requiring of the Baltimore City staff or government or employees to do this, because we even know that from the letter, from the hospital originally with all that, like who's going to be responsible to figure this all out. So, so are you saying that Baltimore City in its current status that they're going to do this work without being paid, or are we going to add monies that will go directly to Baltimore City government to help them figure this out and send the monies to where they got to go. So is there going to be additional fees or monies that's going to go directly to Baltimore City?
Contracting with a third party who's been like one of the third parties that has been contracting and doing this work across the country will be opening an RFP to determine which entity would be most appropriate for us to work with. The recovery office using the ARPA eligibility criteria. There is a very small percentage of ARPA funding that can go toward technical assistance. So it would be absorbed within that $1 million and it would be minimal.
All right, great questions. Delegate Collison, who's been waiting patiently, and then Delegate Johnson, who's been waiting patiently. Go ahead.
Thank you, Madam Chair. I have one question and then a few thoughts. And I heard council say ARPA funds expire in December of 2026. Am I right?
They have to be spent by then.
They have to be spent. And if they're not spent by then, they get sent back to the federal government. Is that right?
I don't know. She probably knows.
Yes. Okay. So I guess, and ultimately what this bill does for a singular purpose, for a one-time expense, it allows medical debt to be sold by hospitals. Currently in Maryland, that is illegal. And so for the purpose of this one-time distribution of funds, that's what this bill does. And the reason it's a local bill, it's because, and I would go to Delegate Morgan and say the equality in this is that every jurisdiction was given money. Every jurisdiction was given money, hold on. And then they were given the right to choose how to use
I'm
that.
not calling you Delegate Morgan. It's okay.
Right.
So, no, wait, let
yeah.
her finish. Let her finish. Let her finish.
So in terms of, this is about localities making decisions about how to use money for their residents. And so I guess I just want to emphasize that this is not ongoing. This is because there is right now a fund available that it's a use it or lose it kind of fund, and it can really help residents of Baltimore City. And that's what the money was used for. And to Delegate Alston's question, if we do this bill, then there is a precedence for allowing debt to be sold. And if in January of 25, Prince George's County comes back and says, it works so well in Baltimore City, and we have X number of dollars left, then I could see, because I believe these funds were dedicated for local usage, that it would be a local bill and that you could come back with that. So I think that this is a great compromise, and it uses the money in a way that will really benefit, as I believe Delegate Bagnell said a little earlier, not just the residents of Baltimore who are experiencing this debt, but also help our hospital system under our current total cost of waiver and our global budget. So thank you, Madam Chair.
And I'm going to be proposing an amendment to the bill. And the amendment that I'm going to be proposing to, I just told council, is that I want to make it really clear that the intent is ARPA fund. And it's, I don't see it that way in the bill now. So council is drafting intent language to put in the bill that it's ARPA fund, because we don't want to set a precedent for anything else, because that is the limitation in what we have been discussing. Okay, Delegate Morgan, I did promise Delegate Johnson, but I say you can respond, so go ahead. Delegate Morrison, Johnson,
yeah.
1 second,
Yeah,
please.
just thank you, Madam Chair. I just want a quick response on that. I have no problem at all with Baltimore City using ARPA funds to reduce their medical debt. Here's the problem, that Delegate Collison. That money was handed out with strings attached back in 2020 and 21. Other counties, and then the strings were attached, were requirements to use that money for broadband, to pay for essential workers, to get through the pandemic. Every other area, as far as I know, and I know my county, has spent out those funds because they spent them out for what they were designed to do, to purpose. And this is, they were, the reason why they were designed for that and the strings were attached was to have economic impact to keep us afloat during the pandemic. Now we're here, what? At least 3 years after any effects from the pandemic, talking about one jurisdiction using the money to pay off personal debt. And that's just not what it was designed to do. So look, and the proof is we have a bill here to allow it. No other place is asking for it. So, I think there is a good bit of difference between the two. Because if the rules were set at the beginning, maybe other jurisdictions would have decided to do that. But apparently other jurisdictions followed the actual intent of the money when they got it originally. Thank you.
Thank you. And I will say that the intent was broad and, and jurisdictions were given a lot of flexibility, whether it was for laptop or, other things. And I think that life is not always neat. It's not always in a box, and things are like you wake up and you don't know what your day holds, right? And things just come up. And we come up with different ideas and try to find solutions. So this is why we're here. But I thank you for the discussion and for the respect that we're all giving each other. Delegate Johnson, I used to have a lollipop here for your patience, okay? Go ahead.
We're good. They're all good questions. I have a two-part question. So I see where they've narrowed it down to who is eligible, and I'm assuming there'll be some kind of lottery to pick some people, because not all of them.
She explained how they were gonna decide that.
So are they going to pay off all of their hospital debt or a portion? I know you have a limited amount of money. So when you pick a person, are you going to pay off all their hospital debt or a percentage? That's one part of the question. Then on page 6, number 4, the commission shall treat the amount of the payment to the hospital under this subsection as an offset to the uncompensated care amount reported by the hospital. So are they going to consider, you mentioned, for instance, $1 buying $100 worth of debt. So are they going to responsible for reporting the dollar, the payment they received, or are they going to report that they took off $100 worth of debt, or whatever ratio you guys decide on? So we're not picking up the debt anyways.
A part of the bill that also speaks to the reduction in commission charge. So that will be negotiated with the HSCRC directly as far as what that reduction would
So
be.
page 2 of the bill, line 22.
Yeah.
Lines 23 to 25 on page 2.
Okay. All right. And then my question on, are you going to pay off percentage of their debt or all of their debt?
The goal would be for individual patients to pay off all of their debt so that it can be cleared from their record. Depending upon the analysis that we get back to see if we can pay for all eligible individuals full medical debt, that would be the goal. But we would know that more once we got to the point of having the information available. But it would be to provide the greatest amount of debt reduction or cancellation to the people that are at most need. So I think the way that I understand it is that the people who are on the lower percentages up like below that 500% of the federal poverty limit will be given prioritization. But for each individual patient, the goal would be to pay off that debt per person and not just a portion of it, because that wouldn't have the greatest benefit. But in the ideal scenario that we're looking to achieve here, it would be paying off all eligible patients' debt.
Okay. Thank you. Thank you, Madam Chair.
You're welcome. Delegate Hill, followed by Hutchinson.
Thank you, Madam Chair, and love the discussion. A couple of things. I wanted to sort of say my interpretation, and I granted haven't looked into ARPA funds and the criteria as well as Delegate Morgan, but my understanding that it was certainly meant to mitigate economic problems and other problems related to COVID, but it did not require that the funds be used to things that were solely related to COVID, so that when we talk about broadband, those were problems that pre-existed COVID, that COVID exacerbated. There was no requirement that it only be used for COVID-specific broadband problems, and they couldn't address pre-existing inequities in broadband. with laptops. People had issues with access to education, other things without laptops that pre-existed COVID, that was exacerbated by COVID. And part of what my understanding of the federal funds were used to is to try and stop communities and people and jurisdictions from sliding further down the hill because of COVID and the inability to respond for financial systems and economic systems to respond. That being said, and if I'm correct about that, even in this specific case, there were pre-existing problems with medical debt. COVID certainly exacerbated that. And under this plan, the debt has to be at least 2 years old, which takes us back to 2022, which suggests overwhelmingly that this debt was COVID-related debt, or at least exacerbated by COVID-related debt. So I think that even to your point, if you take the time to think about it, these funds are meeting in even the narrowest purpose and use. And again, it's about helping communities not to slide further down into poverty as a result. Now, that being said, I was going to ask the vice chair if you could help me and the other folks in the peanut gallery understand better what you and Delegate Bagnall were saying about how this debt that the hospitals are carrying, that if they could sell it like other businesses can, like a private practice can, they would be selling for pennies on the dollar. And it's only after a certain amount of time they get to write that debt off. How does that help the HSCRC? How does that help the state generally when they're not carrying this additional debt?
Go ahead, Delegate, Vice Chair Collison.
Thank you. And thank you, Delegate. Essentially what happens is the HSCRC allows a certain amount of debt to be written off by a hospital every year when they've made efforts to collect it and they can't. And so that goes into the calculation of the global budget for each individual hospital. Yes, well, we want to make sure that they may not be made completely whole, but that is a part of that contribution. If they're able to collect, at least in this one instance, it will affect the formula for the next year so that there will need to be lower amounts of funding from HSCRC for charity care or for uncollected debt. There's two different things, charity care and uncollected debt. So, at least there'll be a bump in 1 year's time where the HSCRC will be able to not spend as much in Baltimore City on uncompensated care.
Even though the hospitals won't receive, they'll receive some money for this.
Yes.
They can then write it off and say, we no longer carry that debt.
Correct.
And not carrying that debt has benefit on their balance sheet.
Yes.
That pays forward. And then that benefits HSCRC and benefits the taxpayers.
Right, in that, yes, because it's all in their calculation of the formula for each hospital. Okay.
All right, Delegate Hutchinson, and then I saw Riley.
Okay, I'm gonna go back again. $640 million was given to Baltimore City. You have $1 million for this program. Is this the last $1 million that the Baltimore has? And you're just trying to figure out what to do with it? Or is there other funds that are still out there that you're trying to figure out what you want to do with it?
So allocation versus obligation versus expenditure. Those are the kind of steps in the process for our ARPA allocation. Last year, we had decided that we wanted to take a step forward to alleviating some of the medical debt that our city residents had. We determined over a series of months that we were not able to do that and that we would need an explicit change at the state level in order to do that. At this point in time, all ARPA funding has been allocated. Obligation requires for us to go through a series of contractual processes, and that is what is reported to the U.S. Department of the Treasury. That is all required by December 31st of this year, and then the expenditure deadline is December 31st of 2026.
It does look like the city's been pretty creative with what they're doing with their ARPA funding. I'm on your website right now and seeing that funding's going to the Pratt Library for a new HVA system. A number of not-for-profits are getting funding. It seems like I don't know all the definition of how ARPA can be used, but it looks like there's an awful lot of money going out for things that are not COVID related. Would that be correct?
No. Respectfully, the Recovery Office does quarterly and annual reporting to the U.S. Department of the Treasury. They follow very strict guidelines as to what is eligible and what is not. That is all dependent upon the final rule issued by the U.S. Department of the Treasury. Our library systems in Baltimore City are more so community hub centers. We have lawyers that work in the library, social workers that work out of the library. We have a lot of after school programs that take place in our libraries. So they're much less libraries than they are community centers. And they are places that people tend to congregate and that were utilized at a higher rate at certain points during the pandemic and as a result of the pandemic where people are coming to access resources. So every single expenditure has fallen under the eligibility criteria. There were also a number of various programs. So there was our ARPA allocation. There were a number of different programs for rural broadband, for rental assistance and eviction prevention. So there were a number of different programs that were all related to COVID funding, but we do follow all federal guidelines concerning allocation and expenditure.
Delegate Riley.
Thank you, Madam Chair.
You're welcome.
So I don't know if you would know, so if we pass this bill and by passing it, it's going to get rid of the medical debt in Baltimore City hospitals. How does this affect, does it benefit the renewal of our waiver? Is that one of the reasons why maybe we have to do this now? Or do you do not know about the waiver?
I don't know specifics of how this bill would affect that.
Okay, thank you.
Yeah, and I would say probably not because it's only like $1 million up to $1 million. So I wouldn't think that it would because it's such a small amount.
Forgot to ask it. The other question was, okay, when this original bill came in, it was a statewide bill. So it seems like if it's really this good, then it should still be an option for the entire state for those jurisdictions that may have ARPA money left. Do you know the reason why it was reduced to just Baltimore City?
I know that for Baltimore City, this is a very important issue. We felt that it may not have had as high a level of importance for other jurisdictions, and we wanted to be able to pursue that opportunity. So I can't speak to the amendments as they were introduced to this committee and having them be brought before us today, but.
Okay, thank you so much. I appreciate it. So does the Madam Chair, do you know that answer to do we know if there's any other jurisdictions that has money left that they could use it in the same way?
I don't know, but I could tell you that if there were and they wanted to, trust me, they would have been here already. I would have gotten an email already, right? We have Mako that is very active and vocal in this committee. And I would say that most of the jurisdiction has spent their monies already. And that's the reality. Yeah.
Premises and the guidelines of the ARPA money. Okay. All
They have
right,
already spent it. Okay. And just for the record, the AG has already responded and is working on the request for Delegate Shalega. That we have an amazing AG department. And I want to thank them on behalf of the AG of the HGO Committee and the General Assembly for your hard work because we bother you a lot during session. I know I do. All right, I don't see any. Oh, Delegate Banderi.
Thank you, Madam Chair. Quick question on implementation and administration. Basically, I think city would need to set up a process for administrating the program, which might involve application from resident, verification of medical date, and direct payment to healthcare. Can you explain that the transparency and the implementation and administration issues that does city has that framework already?
So we would be working with a third-party nonprofit to assist, but we would receive, once we have hospitals agree to participate in the program with us, we would receive data and contact those individuals for them to consent to participate in the program.
How far are you with that?
We are waiting for the ability to legally perform the next steps.
Yes. All right. All right, then. Thank you, everyone, I feel like we have a PhD now on this. For your discussion and respect and patience as we did this. Look, we know that we do a lot statewide. We do a lot for local jurisdictions, right? That we know that they know what's best for their jurisdiction. And these money, a lot of jurisdictions have already spent them. And this is an opportunity to help the residents of Baltimore City. Is restricted to them. The money was given to them. The bill in front of you that we would be voting on is a reprint. It has been given to all of you. In addition to the amendment that I like to put on to make sure it's ARPA funding, because that's what we have been discussing, that is the intent. Very limited. And we're going to make sure that the title reflects that it's only for this jurisdiction. So Erin, can you please,
I think you.
I did it? I describe it well? Okay, so.
For you, intent language for ARPA funding and the title amended to that it's Baltimore City.
Okay. So the amendments have been moved in second. Discussion, Delegate Hill.
Delegate Austin had asked if there could be enabling legislation saying other jurisdictions with remaining ARPA funds who wish to do the same may do so, because they have a December 31st deadline too. And I thought, I assumed that the reason we weren't going to do that is because with the time frame we're in, to do any additional amendments would be problematic to get it out on time. But because we want to ensure that it is ARPA funds that are used, we're going to do that other amendment. And I just wanted us to consider.
Then it's not a local bill. Then it's the bill as introduced. That's right. That's right. Yeah, Delegate Hutchinson.
Can the amendment say up to $1 million of ARPA funds?
Why would we want to limit it?
I mean, that they have $1 million that they've allocated to it.
But it's low. If they find more.
Why would that make a difference? And I'm asking just respectfully.
It just really just based upon them saying that they've allocated $1 million for the program,
Yeah.
and that's what they have for it.
Yeah, it's their local decision, right? And she says it's up to $1 million that they have. I really. Go ahead and respond.
Yeah, I think we won't know the true dollar amount of what is
Yeah.
eligible for the program until after we're able to analyze it. We have approximately $1 million, or we're looking to allocate up to $1 million. But I would resist having that cap be put on there just in case it's $1,001,001. And that would cover everyone. And so, that is how we're looking at things, but until we have the ability to actually have the data and understand the full level of debt that we would be able to cover, I would be hesitant in putting a cap on it and then leaving people left without the relief that we're trying to provide to them.
But thank you for the question and suggestion. Okay, so the amendments have been moved in second. We have had discussion. Delegate Bandari?
No, I think.
Okay.
Yeah,
Okay.
that's, I think it would be better to give the more power to local jurisdiction. And if there is extra money, and they can use it as well, so
Okay.
that's.
All right. So the amendment have been moved in second. All those in favor say aye. Any opposition to the amendments? All right. So the amendment, all of those amendments passed, all three. The bill has been moved in second. Any questions, any further questions or discussion? Vice Chair Collison.
Want to clarify, we're voting on the bill, whatever the outcome is. If the bill passes, it's contingent upon a positive.
We're gonna
response.
wait, we're gonna vote on the bill, and we're going to wait for the AG. If the AG comes back and says it's unconstitutional, we can't do it.
Right.
Okay?
Just so I know that we're following.
Absolutely, and I gave my word to Delegate Shalega. Okay? All right. Okay, any other questions? All those in favor say aye. Any opposition to the bill as amended? Okay, Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you. Sure.
Very fond of my Baltimore City colleagues. This is not about Baltimore City, with all due respect to our friend here at the table. But I think we didn't get a full hearing on this. We didn't have the HSCRC here. We didn't have the Hospital Association. It's the last hour here, so it is not, I know people take this personal. It's not a personal thing.
Yeah.
And, I don't want to deny Baltimore City their ability to do what they want to do, but
Okay.
for those reasons, I'm a no, and I thank you for asking for that.
No,
HGO opinion.
I respect it. And for the record, we had a full hearing. The hospital gave a letter of information, and their concerns were addressed because the parties met and they're satisfied. The HSCRC gave a letter of information. The parties met and they're fine with it. And the bill is limited, very limited to the same subject matter as it was introduced. And we have a letter from the delegation. Thank you so much. Delegate Hutchinson.
Play my vote as well as a past resident of Baltimore City for 20 years. I care very much about the city and how it's being done and run. I'm a no now, but
Should we take a bet? No.
On the floor? I need to think this through over the weekend.
No, and I appreciate that. I do. And I respect that. Delegate Chisholm.
You get to explain my vote now too, then. I don't hate this bill. I don't. I think but I would like to get the AG's opinion, and
That's
then I'll
fine.
make a decision then.
And you know what? I try very hard to make sure that we have discussion here and that everybody can express their views, which is why I will hold it until we get the opinion, all right? Because I want you to feel that you have everything in making your decision, okay? It's important. And we don't do things on this committee without crossing our T's and our I's, okay? So I want to make sure we do that. Delegate Bandari and then Hill.
One of the key points in ARPA funding was support state and local government. And I truly believe that. I was confused in the beginning, and this bill can support the government to mitigate the fiscal effects stemming from the health. I mean, it is a public health thing, so I feel comfortable with the amendment.
Okay, Delegate Hill.
Just wanted to explain my vote. I love this bill. I love this bill because, disparate effects, and by that I'm not talking race, but communities of poverty, effects on people when they're hit with medical debt, they add up. They add up. And I love the fact that we're giving an opportunity for some folks adversely impacted by COVID and maybe knocked on their butts to get up and move forward. And by doing so and allowing them to move beyond that debt, they're in a better position to contribute to their community, to meet what other obligations they have, to take on additional debt, to grow, to change. I love this bill because I think it helps deal with some of the grassroots problems of so much of what we see around the state, which is that once you get in a hole, it's really, really hard to get out. And so the opportunity to help people to get out of the hole and stop digging is one that I think we should be looking for more of. Thank you.
Okay, thank you. All right, so the bill passes. And I want to thank everyone for having this discussion, for being generous with your time, and for all the work that we have done on the committee. It is 2:57. I hope you have a blessed weekend, okay? Delegate Shalega, may I, oh, wait a minute. We have Delegate Shalega, may I speak with you for a second? We have a guest, and may we have her speak, please?
Hi.
This is AJ, of course.
This is AJ.
Her name is BK, right?
Future HGO member. All right, you can bring us down. Have a great evening. Delegate Shalega.